story.
Investigators are trying to figure out how a nurse who treated Ebola patient Eric Duncan contracted the deadly disease. The hospital says she followed Centers for Disease Control protocols and wore protective gear, a face mask, gloves, shoe, and leg covers. But the CDC says there was a breach of protocol, perhaps when that protective gear was being removed, and that caused her infection. One nurse suggests more needs to be done than just pointing fingers at nurses.
When the nurses become infected, they are blamed for not following the protocols. That is not going to work.
The infected nurse is apparently in her 20s. She started feeling symptoms Friday and drove herself to the hospital. Hazmat crews decontaminated her apartment, and that made at least one neighbor uneasy.
Definitely it's scary being in Dallas, but then when it's like right here.
A recorded telephone message was sent out to Dallas residents.
Please be advised that a healthcare worker who lives in your area has tested positive for the Ebola virus.
CDC Director Thomas Frieden says it's possible other healthcare workers who came in contact with Duncan may also be infected.
Unfortunately, it is possible in the coming days that we will see additional cases of Ebola.
No other healthcare workers have shown Ebola symptoms, but as a precaution, at least one other worker was placed in isolation. If other U.S. Ebola cases are possible, if not likely, what should be done to stop the deadly disease from spreading? A former director of the CDC says only 4 U.S. hospitals are currently prepared to handle Ebola patients. They're in Montana, Nebraska, Georgia, and Maryland. So potential cases should probably be transferred there. So far, Ebola in the U.S. has been contained to Dallas. 2 other suspected cases, one in Los Angeles and another in Boston, were false alarms. Gary Lane, CBN News.